I'm not a fan of scripting, but this one you might want to script. Hey, Naren, this is Dr. Paul calling. I like to call my patients on the evening of treatment. I was just calling to check in with you and see how well you're doing. Okay, now hit pause for just a minute there. So that's the start of the call. Naren, this is Dr. Paul calling. I like to call my patients on the evening of treatment. Let's break this down. The reason I like to say that is, notice what he didn't say. Hey, I was calling to see if you're having any problems. Why? Should I? No. So you don't say that. So you say, I like to call my patients on the evening of treatment. I was just calling to check in and see how well you're doing. Now, let's turbocharge this. So, you know the concept of turbocharging.
Yes.
If you turbocharge your motor in your car, you get a lot more horsepower out of it. So let's get a lot more horsepower out of this. During the day, Paul would keep a folded up copy of his daily schedule in his lab coat pocket. And between patients, he would write down notes that the patient would share with him. And Naren might have shared, hey, Paul, it's an exciting day for me. We're supposed to find out the universities my daughter has been accepted to for next year. You might have shared that with him. Okay. So Paul's going to make a note on that. And when he calls you in the evening or leaves a message, he's going to say, Naren, Dr. Paul calling. I like to call my patients on the evening of treatment. Listen, I was just checking in with you, see how well you're doing. Listen, no need to return my call. By the way, I've been thinking about you and your daughter all day. I hope that the outcome was what you and her wanted when you get those acceptance letters. You should be very proud. Hey, I'll see you on your next visit. What does that do, Naren?
It creates that relationship. It strengthens that relationship to a totally different level. It's just...
You might have just said, hey, I've got an emergency meeting. I've got an important meeting at work today. I got to get out of here on time. I got an important meeting. Paul's going to say, hey, hope that meeting went well at work today, Naren. I was thinking about you. And so he has something personal to add. Now, let me add one more component to this. Naren, you've heard me talk about systems, correct?
Yes.
So you want to systematize as much as you possibly can in the practice so it's not left random or to chance. So here's what we did. We decided that anybody that gets an injection, anybody that gets a shot, gets the evening we care call. Now, why is it that? First of all, injections are not a big deal, especially if the office knows how to give painless injections. But sometimes people get a little nervous about it, and so it is something that is a big deal in their mind. But the second reason we do that is that it's now a system. Now it's not left to chance for Paul to call people that he thinks might appreciate a call. Anybody gets a shot, gets a call. Get a shot, get a call. So now it's a system. It's an absolute system. Naren, you would not believe how many patients will comment their next appointment, and they'll comment to Meg or Carly or Marty, our administrative team. They'll say, Marty, you won't believe this. Do you know Dr. Paul called me after my last appointment? And Marty just smiles. He loves to do that, Naren. He loves to connect with his patients. Yeah, I just can't believe anybody does this. As busy as he is and as important as he is, he made the time to call me. Hey, thanks so much for watching this video. The full podcast episode link is in the link below. Don't forget to hit the subscribe button if you like our content.